COVID antibodies. You either have them or you don't. But for those of us who do, you can get them 2 ways, possibly 3. There are a lot of unknowns, and we explore how you can have these antibodies, what it means, what a COVID antibody test is if you're not vaccinated, and if doctors recommend you to get vaccinated if you have the natural COVID antibody. Here are your answers in my special report, only on WMBF News. Antibodies, little fighters in all of us. They keep illnesses at bay, fight off disease, and do their best to keep us healthy. But some of us have specific antibodies we've built from fighting off COVID-19. If you're like me, you've never knowingly been infected by COVID-19. So, out of a growing curiosity, I decided to get tested at my doctor's office to see if I have the COVID-19 antibodies.
Almost done.
So, what are COVID antibodies and why are they important? Conway Medical Center's Dr. Paul Richardson says antibodies in general are proteins produced by our body's immune system in response to a foreign invader. These antibodies bind to those invaders to keep them from latching on to other places in our bodies that could make us sick. In the case of COVID, after we're either infected or vaccinated, we produce an antibody to fight the spike protein. COVID uses the spike protein to get into our cells, but if you have the natural antibody from fighting COVID or vaccinated antibody, the idea is the antibody binds to the invading spike protein. And then, ideally, it can attach to you and is unable to make you sick.
I'll do this tie, okay?
Problem is, it's still unknown why some people are asymptomatic to COVID or seemingly immune or show very little symptoms, while others get extremely ill or die from it. What we do know,
it is a very, very well-proven vaccine.
Since the vaccine first rolled out in December, the people who mostly wanted to get the shot have gotten it. Since then, vaccination numbers have greatly dipped. The question is why?
I read it on social media all the time. This is new, this is brand new, experimental, guinea pigs, blah, blah, blah. This technology has been around for quite some time. It dates actually back to the first SARS outbreaks that occurred in the Middle East and even 20 some years ago. So this is not new tech. While these are, yes, by definition, these are new vaccines, it's not new technology that the platform is built on.
Some question the vaccine's technology, while others question the strength of the natural antibodies they may already have.
We have patients that sometimes might have positive antibodies with no known exposure to the virus, didn't get sick, and for whatever reason went and had a proprietary antibody test and shows, poof, they've got antibodies, SARS-CoV-2, COVID-19 virus. And you wonder how that happened. Well, we're not sure. I mean, I know that sounds like a gray answer, but we still don't understand some of the testing.
While Dr. Gerald Harmon with Tidelands Health says he believes the 2 antibody tests available are not quite reliable yet, Dr. Richardson says he trusts them.
So my guess is they're going to be fairly accurate.
There are 2 antibody tests, qualitative and quantitative. Qualitative tells you only if you're positive or negative for the antibodies. Quantitative gives you an actual number if you're positive. If you're 0.7 or above, you have COVID antibodies in your system.
Does that mean you're currently immune, that you might have been exposed to it? Did you retain immunity? We just don't know yet what each individual test means.
What we do know is my test results are negative for both antibody tests. However, my mother, who has never suffered symptoms of COVID-19, has tested positive 4 separate times for COVID antibodies since August. In the last test, her quantitative test registered at over a 370, when all she needed was more than a 0.7 to be positive.
Here's the issue with the number at this point, though. I don't know that we have normal range numbers. That's where I would be. So if I got a 20 and you have a 10, we're probably too early to know if I'm more protected than you. I don't know that's true. That may mean nothing or it may mean something. I think it's too early to tell that.
Numbers aside, there are more people like my mother out there.
We know they're out to 6 months. And I think case in point of you're familiar with cases out 8 months. I think we're going to see it out longer than we initially anticipated. How long is lifelong? Who knows? Will boosters be necessary? Probably, possibly, who knows? I think that jury's still out on that one too.
So are people like my mother, who have the native antibodies in their systems, more protected than those with vaccine antibodies?
I don't know that either one's going to be better than the other. I think the jury's still out on that. That's a great question. I don't know. I do know that native infection antibodies should be real, and I think that's being sort of underappreciated, for lack of a better term. Like we mentioned earlier, there is some data around the vaccine eliciting a more vigorous antibody response than many patients who had native infection. Not all, but many.
Some people seem to be virtually resistant, not so much immune resistance to a lot of infections. You're right. And we found that those that have chronic diseases like diabetes, cardiovascular disease, obesity, didn't get the resistance to the COVID viruses as the other folks. So some have probably not antibodies, but antibody response is better.
Dr. Harmon and Dr. Richardson agree. If you have the natural antibodies, getting a vaccine works as extra armor against COVID. They say the vaccine will not lessen your body's natural antibody response.
Because that really gives you a booster that seems to have a longevity past just a natural immunity. It seems to raise your antibodies even higher.
This month, Tidelands Health was the second healthcare system in our state to mandate COVID-19 vaccinations for employees. However, the hospital recognizes the important role natural COVID antibodies are playing as we learn more about this virus. Tidelands Health employees who previously tested positive for COVID are exempt from having to get the vaccine. I do want to reiterate, though, both doctors we spoke with want everyone to get vaccinated. Natural antibodies or not, they say this is how we can control the severity of people's COVID symptoms and stop people from dying. For example, here are today's COVID hospitalization stats from Tidelands Health and Conway Medical Center. At Tidelands Health, 17 people are hospitalized today. Of those, 6 are in the intensive care unit. 1 is on a ventilator. 1 of those patients is vaccinated, while the other 16 are not. At Conway Medical Center, the hospital says it has 12 COVID patients hospitalized today. Of those, 5 are in the intensive care unit and 3 are on ventilators. None of the 12 patients are vaccinated. So, Eric, this story has a lot of moving parts. And when I first spoke with Conway Medical Center for the story a month ago, I was told the hospital at the time only had 1 patient. They were super excited about that. They were anticipating getting to 0, but that never happened.
Yeah, so a lot of unknowns at this point, but those numbers you just showed definitely do not
Those are
lie.
knowns.
Yeah, so when it comes to the Delta variant, how does that play into all of this with regards to the changes that we've seen in the past month?
Well, officials today are telling me at Conway Medical Center that they don't test for a COVID variant. So they don't test for the Delta variant. These people that are currently in the hospital, they say that's done at the state level, and COVID treatments are the same no matter the variant. So right now they really don't have a need to do that. And Dr. Richardson did tell me last month it wasn't a big player here. The Delta variant here at home wasn't a big player, but this data that we're seeing today can just show how much numbers, how much anything can really change.
In an instant.
In an absolute instant.
Yeah.
This has lots of moving parts, like we said at the beginning. You can find out what the future of the COVID vaccine might be and learn more in this story. This is posted on the homepage of WMBFnews.com.
All right, a lot of good information. Did South Carolina